am Pradeep. Today we are going to study about inferior aperture of thorax. Thorax is inferior aperture is the broad end of the thorax. That means we are studying in the previous lecture. The upper part is the superior aperture. In inferior aperture are present at the below of the thorax. That means you will see here that is thorax inferior aperture. This is covered by diaphragm. This diaphragm is separate upper thorax and the abdomen. This is the abdomen. These two trunk are divided by diaphragm. Upper part is called thorax and lower part is abdomen. Now we are going to study about boundaries of the inferior aperture. Anteriorly, we are seen infrasternal angle between the two costal margin. We are seen in the thorax. This is the sternum. This is xiphoid. From this sternum, ribs 7th, 8th, 9th ribs are present in that position. This is stern. This makes angle is called infrasternal angle. Posterior, we see in the posteriorly the inferior surface of the body of the 12th thoracic vertebra. 12th we are seeing 12th thoracic vertebra. This is the 12th thoracic vertebra. Upper surface, inferior surface of the body of the thoracic. This is the body. This is the body, and inferiorly, this is the posterior boundary of the inferior aperture. On the each side, costal margin is formed by the cartilage of the 7th to 12th ribs. In each side, we are seeing 7th to 12th ribs are present. These ribs are formed boundaries of the inferior aperture. Now we are going to study brief description of diaphragm. Diaphragm is the made up of large muscular tendinous partitions close the outlet of thorax. This diaphragm present inferiorly, and this diaphragm is made up of large muscotendinous partition, and this diaphragm are closed the outlet. We are seeing that this is the thorax. From here we see dome shaped like structure is called diaphragm. This diaphragm separate thorax and abdomen is called diaphragm. Also called thoraco-abdominal diaphragm, because this diaphragm separates the thorax from the abdomen. This diaphragm thorax. This is the thorax and this is the abdomen. This two trunk. This is the part of trunk, and trunk is divided by diaphragm, and diaphragm divided into two parts, thorax and abdomen. Now we are seeing which structures passes through this diaphragm. There are three large opening and several small opening. First we see about three large opening. There are these large opening are named as vena cava, esophageal opening, or aortic opening. These are present. Vena cava opening is present in the central tendon. We see here in the diagram. This is the central tendon. In this tendon, we are seeing vena cava opening. This is the vena cava opening. This is the vena cava opening. In this vena cava opening, there are present inferior vena cava, right phrenic nerve. These two structures are present. Oesophageal opening. Oesophageal opening. This is present in the right cruise of diaphragm. This is the right cruise. This is the right cruise, and these are ophageal opening present here because this is the two-dimensional structure. In three-dimensional structure, we are clear that seen. This is second opening, and third opening. In this diagram, in this opening, we are seeing the oesophagus, vagal trunk, and left gastric vessel. These three structures are present in the oesophageal opening. We see in diagram. This is the left vagus and right vagus. Means this is the vagal of trunk, both right and left vagus. And oesophagus. This is the oesophagus, and last is the left gastric vessel. Here is also present left gastric vein or vessel. This is the vessel. This is the vessel. And then aortic opening behind the median archotic ligament. Medial archotic ligament. There are three ligament. First ligament is median ligament. This is the median ligament. This is the medial. Both are different. This is seen spelling of the medial and medial. This is the median. Last is n, and medial is ending with l. This means median and medial. Median is present in the between in the center, and medial is means in near the medial structure, and one ligament is presented laterally. This name is called median archotic ligament. These are present in the central, and lateral ligament is laterally, and when in these are the three large opening. If this three opening when constrict means contraction effect of, we see some extra point when these opening are contraction effect we contract this opening. What effects are seen in this opening? First, when vena cava opening is contract, then we see in this opening dilation is occur, and oesophageal opening if contraction of oesophageal opening, we see constriction, and if archotic opening is contract, there are no any change. Archotic opening is present median archotic ligament. We see here this is the median archotic ligament, and behind this we are seeing archotic opening. And the structures are present here are zygous vein, aorta, and thoracic duct. We see in diagram. This is the aorta. This is aorta. This is the zygous vein, and this is the thoracic duct. Now we go forward, and at several openings are present in the diaphragm. Small opening. There are so many small opening. First is superior epigastric artery present in space of larvae present between slip of xiphoid process and seventh cartilaginous slip of the diaphragm. This is the epigastric artery, and these are present where space of larvae, and these space of larvae are present where between xiphoid process and seventh costal cartilage. We are clear seen in the three-dimensional figure, but sorry for that, I can't see this video in three-dimensional, so we are only studying two-dimensional. This is the and this opening this space of larvae are also called foramen of Morgagni, Murga's when we call the foramen of Murga's when opening are enlarged. Now we have to go forward where muscophronic artery. These are present at the ninth costal cartilage. Ninth costal cartilage. These are present as ninth costal. These are not present in the diagram because these are seen only in three-dimensional figure. But in this diagram are two-dimensional. But I can try to you understand. Now go to the third part. Subcostal vessels and nerves are these are structure are present behind lateral aortic ligament. This is the lateral aortic ligament, and these are the lateral ligament, aortic ligament, and behind this we see that subcostal vessels and nerves are present, passes from lateral aortic ligament, and sympathetic trunk passes behind the. This is the sympathetic trunk, and these are pass from the medial. This is the medial aortic ligament. Once again we can repeat it. Subcostal vessels, subcostal and nerves are passes from where left lateral aortic ligament, and sympathetic trunk are passed from behind the medial aortic ligament, not from medial aortic ligament, and greater and lesser splanchnic nerves are passes from. This is right and left cruise of the diaphragm. This is the right and this is the left cruise of ligament, and from here we see this structure: greater splanchnic nerve and lesser splanchnic nerve. These are two structures. These structures are present on the right and left both side. Now left phrenic nerve pierces copula. These structures are also not seen from that side. We are seen only from. This is the inferior aperture of thorax. This lecture. Thank you.